All right, let's go over breast cancer. I guess you guys need a little refresher on this. All right, so what is breast cancer? In general, it's an abnormal growth of breast tissue. There are a bunch of different types that you can have, lobular, ductal. We won't get into that, just abnormal growth of breast tissue, cancerous growth. Contributing factors are family history. So, a significant risk factor is, a strong, like, pedigree of family history of breast cancer. Early menarche, late menopause. So typically menstruation starting before 12 and ending after 50. That would be considered early and late. The reasoning is behind a lot of these risk factors is your exposure to estrogen. So estrogen is a known promoter of this type of cancer. Long-term hormone replacement therapy, specifically estrogen, nulla gravida, so never been pregnant. Being overweight, having a sedentary lifestyle can increase your chances. Excessive alcohol intake and smoking. Those are also promoters. The BRCA1 and the BRCA2 are genetic mutations that you can inherit and put you at a high risk for developing breast cancer. And prolonged use of oral birth control. So a lot of this stuff you can see relates to exposure to estrogen and then regular kind of cancer risks, stuff like alcohol, smoking, being overweight, bad diet. So the normal diagnosis comes from the most common sign and symptom of breast cancer, which is a lump or thickening of the breast tissue or the axilla. Some other manifestations may include dimpling, redness, pain, asymmetry. Sometimes there are no signs and symptoms, and the cancer is found on screening or tests. That's why screening is so important. We recommend mammograms every 1 to 2 years for women 40 and older. Clinical breast exam annually. That's an exam done by your provider, your healthcare provider, on once a year, usually during your regular physical or health screening. Self breast exam monthly, 1 week after menstruation. It's important for us to educate our patients on how to do this breast exam, the importance of the breast exam, and the importance of knowing your own breast tissue so they can recognize when there's a change. And then genetic testing, we talked about. Genetic testing is expensive. Doctors typically won't do it unless there's a good indication, which would be family history would be a good indication. And then ultrasound and biopsy. Ultrasound is a great exam when there's some suspicious tissues. It can tell us kind of the tissue, the size, the involvement, the vasculature, things like that. And then a biopsy would be to confirm the cancer. They can do this as like a curative measure also, where they try to take the entire tumor out, or even part of the mastectomy can include the biopsy. They'll take it, look at it under a microscope, do pathological tests on it to see what type of cancer, confirm whether it's cancer or not. So your typical treatment options for breast cancer are going to be similar to solid tumor cancer treatment interventions in general. Chemotherapy is a great option. So systemic treatment to kill cancer cells throughout the body. Um, it's often used when we think this cancer may have spread or to prevent the spread. If it's likely to spread, these are the typical chemotherapy agents prescribed for breast cancer: cyclophosphamide, doxorubicin, fluorouracil. In general, kind of the same considerations for the nurse. We're worried about chemo-induced nausea, vomiting, peripheral neuropathy, fatigue, hair loss, the regular standard stuff. And then the major issue is bone marrow suppression. So anemia, thrombocytopenia, and neutropenia. We know how that will affect the patient. This is the major concern: bone marrow suppression. Radiation, so targeted external radiation that'll kill cancer cells in the breast tissue or the chest wall. And this comes with the standard radiation side effects as well. And then hormone therapy, Lupron and tamoxifen, will sort of target the hormones that are responsible for either the production or the growth of these cancers. So we're typically going to think of suppressing or working on the receptor sites for estrogen when we're talking about breast cancer. Surgical intervention is a very common intervention approach for breast cancer. Many of these women will have surgery. It can be a simple lumpectomy where they remove just the suspicious tissue and a little bit of the healthy tissue around surrounding it. or very common though is a mastectomy, which is removal of the entire breast tissue, either one or both breasts. And very often they take lymph nodes as well. So post-op care is going to be big, something you might get tested on. Uh, Lymphedema prevention, and then your standard, post-op nursing interventions like monitoring drains. They usually have Jackson Pratt drain in for 1 to 3 weeks, monitoring the surgical site, signs and symptoms of infection, and then like sterile dressing changes, wound care management, normal stuff like that, signs and symptoms of infection. And then also a big area to address is lymphedema prevention. So things like head of the bed elevated 30 degrees while they're awake, arms supported on a pillow about at the heart level to promote drainage and circulation. Position the patient on the unaffected side if they need to lay on their side. A sling on the affected arm while ambulating. No injections, blood pressures, blood draws on the affected side. Put a sign up above the bed so everyone knows. Phlebotomists, CNAs don't use this arm. Lymphedema education. The patient's going to go home and they're still going to need to follow these instructions to prevent lymphedema because they have no lymph nodes now, right? They're still at risk once they leave. So things like preventing injuries to that arm, don't use it for blood draws, blood pressures, things like that. And then post-op, we're going to encourage gentle exercises to promote drainage and circulation. Eventually, they'll be able to, return to some normal type of exercises and physical movements. But at first, we're going to take it really easy on them. So breast cancer is the most common cancer in women. It can also affect men, but it's the most common cancer in women. So early detection and treatment are, very likely to improve the chance of a successful outcome of a cure or remission. So we want to encourage our patients to do their screenings so we can detect cancer early, like self exams, clinical breast exams, mammograms. Have a healthy diet by increasing their fruits 3 servings a day, veggies 5 servings a day, and maintaining a healthy weight. Being overweight, sedentary, large breast tissue, those are all risk factors for breast cancer. Limiting alcohol. There are some specific types of breast cancer that are caused by excessive alcohol use, but then alcohol just is a promoter in general for cancer growth. Smoking cessation, so don't start. If you start, let's teach them how to stop. And then family history. If you have a strong family history, you should seek some counseling from a genetic counselor, your primary care doctor, something, so we can detect. And then sometimes they'll do preventative strategies even before you develop the cancer if you have these genes. Gracias.